Hi, I'm Dr. Matt B. with your Emotional Minutes. And today we're talking about traumatic stress or post traumatic stress disorder, which is often referred to as PTSD. And a lot of times people will ask me about PTSD in terms of different ways it can form. How do people develop PTSD? Now, there's sort of an assumption out there if somebody goes through a traumatic event, like a physical trauma, an accident, maybe a sexual assault or trauma like that, there's often the assumption that that person is just going to go on to experience post traumatic stress disorder. And actually, only about 18% of people on average who experience a traumatic event go on to experience post traumatic stress disorder. Now, that can vary depending on the type of trauma, and usually, sort of interpersonal traumas like assault or sexual assault actually has slightly higher rates than that. But there's really no guarantee that somebody's going to experience PTSD from a traumatic event. And as a science, we're still trying to understand it. So it's kind of tough at this point to sort of completely predict who's going to go on to experience post traumatic stress after a traumatic event. But we can sort of look at how people handle experiencing the trauma in the weeks or months after. There are a couple key sort of behavioral or cognitive thought indicators that can really predict whether or not somebody might go on to experience post-traumatic stress. And the first one that we look at is sort of related to what we talked about previously with anxiety disorders, but that's what we call avoidance. So, avoiding places that are associated with the traumatic event, avoiding people, friends, family members. And that can lead to a whole host of other problems. If they start to isolate, then they lose their sense of social support, they lose enjoyable activities they might be doing, and that can oftentimes lead people to go on to experience other things like depression, sometimes substance use, things like that. And the second thing that might predict whether or not someone will go on to experience post-traumatic stress disorder after a traumatic event is that they actually start to experience a lot of negative thoughts or negative beliefs about their own role in the event. And often those beliefs are centered around, maybe their fault, or they blame themselves for, what they might have, what role they might have played in the event, or what things that they might have done to cause the event to happen. So, for example, it was my fault that I got physically assaulted because I shouldn't have been in that certain place at that time. Or it was my fault that somebody else got injured in the event because of the way I handled something during the event. And interestingly enough, oftentimes when you really start to look at those beliefs, typically they're actually not really as realistic as what might have happened when the event actually occurred, because our memories are often pretty faulty, and there's a lot of research on that. And sometimes if we believe that we had some role in the event, then our memories will sort of start to shape around that belief, and we'll actually start to remember the event somewhat inaccurately to sort of be consistent with those beliefs. And there's actually a whole sort of mode of therapy around looking at this aspect of post-traumatic stress that they call cognitive processing therapy. And if people are interested in this, I actually really recommend a podcast from This American Life. And they actually didn't give me anything or any money to say that. I just think it's a really great thing, and I actually recommend it to patients at times as well. So if you've experienced a trauma and any aspect of the trauma is really affecting your life and is really difficult, I always recommend contacting a mental health provider. And you can watch another one of my episodes where I talk about ways to find a mental health provider if you're interested in doing that. And they can really provide a lot of good support. And so hopefully that was helpful today in talking about post-traumatic stress disorder and some ways that that can come about for people after a traumatic event. And if you have any questions or comments, feel free to put them in the comment box. And also subscribe to the channel and turn on notifications for information about new episodes. And again, I'm Dr. Matt B., and these are your Emotional Minutes, and we'll see you next time.